Unfortunately, COVID-19 has affected many aspects of American lifestyle, including nutrition and exercise. Poor and underserved communities have resorted to unhealthy food options like fast food. This is because in parts of the U.S., especially urban areas, there have been grocery stores with shelves empty and unable to source local fresh goods due to suffering local businesses and small-scale farmers. Americans have been turning to carb-heavy diets which resemble Western diets. These are diets full of high amounts of meat, pre-packaged and processed foods, butter, dairy, and sugar. Additionally, before COVID, 40% of Americans were already reported to be obese. This puts them at risk for worse COVID-19 health outcomes. Obviously, quarantine has limited physical activity both outside and in gyms. The lack of physical activity has been shown to decrease immune function and increase susceptibility to viral infections, again increasing risks associated with COVID-19. All in all, COVID-19 has had negative impacts on nutrition and exercise, along with the lack of nutrition and exercise, putting more people at risk for COVID-19 and negative health outcomes.
As far as diet mythbusters go, we will begin talking about the ketogenic diet. As far as whether it is a good choice for the general public, the short answer is no. It has been shown to provide benefits for those with type 2 diabetes and epilepsy due to the high fat content, and it may help lose weight in the short term because you're cutting out the fruits and veggies and the carbohydrates that do cause weight gain. However, carbohydrates are the main source of energy in the human diet, and limiting them could cause a severe reduction in energy as well as increasing your risk for nutrient deficiencies in the long term. So the conclusion is that in the short term, it may be helpful, but in the long term, there are some pretty strong negative health risks associated. Fads that has come up recently due to the rise in COVID-19 is the immune system support diet. It is thought to help combat infectious diseases such as COVID-19. The whole gist of it is that you will decrease the amount of processed foods being consumed and you will increase your ability to choose well-balanced meals. So, while attempting for a more balanced diet is helpful for your overall health, the immune system is highly reliant on many different factors such as stress, age, environmental toxins, as well as your diet. So while it is good for your overall health, it will not stop someone from contracting the infectious disease on its own. The last of the diet mythbusters that we'll be going over are 0-calorie sweeteners and vinegar. So lately we've been hearing a lot about both of them. People are starting to take more 0-calorie sweeteners, which are things like Truvia, Stevia, Equal. While they are 0 calories, they do increase the urge to consume other sugary substances. So while you may not be getting sugar in your coffee that you're putting stevia into, you may be getting it in other ways because your body is craving it. Vinegar, on the other hand, has been shown to provide some health benefits. People typically use vinegar to help with weight loss, and it actually has been shown to increase the feeling of fullness after a meal. And it also has been shown to control blood glucose in both normal populations as well as people who are categorized as prediabetes and diabetic. So overall, we would say that 0-calorie sweeteners are a give and a take, and it may not be the best choice for the general public, while vinegar has some health benefits and may be something to look into.
So eating the right foods and getting a good nutrition during quarantine is important for a healthy immune system. Consuming enough fiber, especially soluble fiber, can help slow digestion, control weight, and it can be beneficial for insulin sensitivity. A rich fiber diet can also help lower LDL, called the bad cholesterol. The daily adult recommendation is 25 to 30 grams. And to get the most benefit from a high-fiber diet, you should be consuming whole oats, beans, berries, lentils, and potatoes. It is recommended that you eat 5 servings of fruits and veggies per day. Some examples of servings are 1 cup of raw carrots, 1 cup of raw spinach, half a cup of cooked broccoli, 1 small apple, and 1 banana. Limiting salt and sodium intake is also very important. The World Health Organization recommends consuming less than 5 grams of salt per day. Drinking plenty of water throughout the day also helps maintain a proper balance of body fluid. It is recommended that your intake of sodium is less than 2,300 milligrams each day. This is equivalent to about 1 teaspoon of salt. It is important to load up on fresh fruits, vegetables, and low-fat dairy, such as bananas, dried apricots, spinach, low-fat yogurt, green beans, and more. You should also limit sauces, mixes, and instant products, as well as flavored rice and ready-made pasta. Try to keep takeout food and fast food to an occasional treat. When eating frozen and canned vegetables, choose the no salt added or low sodium versions. And I know it's difficult, but try to avoid snack foods like chips, crackers, and pretzels because they are loaded with hundreds of milligrams of sodium. Food that contains less than 35 milligrams per servings are considered very low in sodium. Foods that have less than 140 milligrams per serving are considered low in sodium. In this slide, I just wanted to add the range of sodium content for each food, and to keep in mind that foods with only moderate amounts of sodium, such as bread, can be major sources in our diets because we eat so much of them. And also, the majority of sodium in our diets comes from packaged and restaurant food, and it is a direct result of food processing. So some tips to stay on a healthy diet are to make a schedule or a daily meal plan. Studies have shown that if you write it down, you're more likely to remember to do it. Also, another great way to stay active if you are just beginning to is to download a fitness app to help with proper nutrition and provide you with workout videos. MyFitnessPal app, for example, is one great way you can count calories, macros, and micros to help with your nutrition. It is also very important to manage your environment. So, what really helps is not keeping junk food at home. So when you go grocery shopping, try to select healthy foods and avoid buying candy. Therefore, you won't have it home to eat it. Also, a great way to stay connected with your friends is to also start your healthy journey with them. You can both hold each other accountable for working out or eating healthy. Reducing anxiety and boosting your immunity is especially important during this time. Eat citrus fruits and red bell peppers to ensure you get enough vitamin C for the day. And some spices that are great for you are ginger, garlic, turmeric, and capsaicin. And getting, of course, enough foods that are rich in zinc and magnesium will help support your immune system. And some of the foods are listed here for you. Staying physically active during quarantine can be a little challenging for many different reasons. The World Health Organization recommends 150 minutes of moderate intensity and or 75 minutes of vigorous intensity physical activity per week. A great workout on a treadmill is the 12-3-30 method, which is walking at an incline of 12 at a speed of 3 for 30 minutes for 5 days a week. You can follow YouTube workout videos such as Fitness Blender, or trying high-intensity interval training is also a great way to challenge yourself. It's important to get outside as much as possible, like going on a walk, on a jog, or riding a bike. Fresh air provides a mental boost for your mental health, and remember to maintain a safe distance between yourself and other active neighbors. If you are someone who gets bored of the same workout routine, you can keep your workouts interesting by making a workout playlist, listening to podcasts, joining a virtual dance, or even a spin class. Also, making household chores into workouts, like perhaps scrubbing, or vacuuming, or carrying loads of laundry.
What is the role of the pharmacist in promoting health behaviors? Pharmacists have an integral role in promoting health behaviors and the well-being of all individuals. Pharmacists can counsel patients on nutritional supplements such as vitamin D, calcium, multivitamins, omega-3s, fish oil supplements, iron, and vitamin C. Pharmacists can also counsel or refer patients to other external resources such as nutrition support with a nutritionist. Pharmacists can not only help out with medication management, but they can also help with tobacco cessation, nutrition counseling, immunizations, diabetes management, and blood pressure management as well. Thus, pharmacists can help an individual manage their overall well-being, which leads to health and wellness.